The government of Kenya has shown an impressive commitment to combat HIV by putting in place an ambitious testing program. Similarly, great strides have been made in the fight against tuberculosis, resulting in Kenya being the first country in sub-Saharan Africa to reach global targets for both detecting and treating TB. A key population in the fight against HIV and TB is the prison population. Ignoring prisoner health undermines Kenya's broader health goals. In April 2014, HealthStrat partnered with the Kenya Prison Service to implement a 6-year project called Tact.
Transforming TB and HIV prevention care and treatment project has been a 6-year project that has been implemented for the last 6 years, since April 2014 to September 2020, in collaboration with the Kenya Prison Service. And HealthStrat has been the prime recipient of this particular award by CDC.
I know that HIV has been with us longer, but the Tact Project specifically looks at changing or transforming the lives of the people that we have within the prison in as far as HIV and TB are concerned.
The project had 2 broad goals.
Specifically in this project, it was supporting 2 broad areas, that is strengthening the systems of Kenya Prison Service to enable them to run as a lead partner the HIV-TB response within the prison systems. The second broad area was on the technical part, where we were supposed to strengthen their capacity to be able to lead the HIV-TB response within the prisons.
The project pursued these goals through strategic aims, the first of which was program management and transition. The Tact Project built the capacity of the Kenya Prison Service to enable them to plan, implement, evaluate, and manage a USG-funded grant for comprehensive HIV and TB prevention, care, and treatment.
So we oriented the ACU committee to be able to understand their roles and responsibilities, and they've been very key in supporting the project as an oversight. So they provide oversight to the project. We supported them in developing an operational manual to guide the running of the project that really clearly stipulates what are their roles and responsibilities.
Within the structures of ACU, we have the secretariat at the headquarters, and then we have the regional coordinators at the regional level and the sub-ACUs at the facility levels. So we coordinate implementation of those programs within the structures, working with the technical teams that form the secretariats. And of course, liaising, of course, with the ACU committee, who are our oversights, and of course, responsible also to my head of the department, Commissioner General, who is a patron of the program.
The key achievements under this aim were strengthened leadership and governance through training the AIDS Control Unit Committee to provide oversight on project, development and operationalization of the AIDS Control Unit ACU Committee Charter, development and operationalization of key policies such as risk management framework, internal audit, and ACU operations manual, financial and internal control systems set up.
Kenya Prison Service has an oversight body, that is the AIDS Control Unit. We also were able to work with them to develop a risk management framework. This helped them to understand what are some of the risks the organization or Kenya Prison has as they manage the donor funds. Just them being able to understand the compliance and what is expected by the donor has also been very key in helping us move forward, so that when we provide the resources, then they're able to keep to what is expected to the donor, and then we are able to achieve the objectives of the project. So
initially, we were managing all the funds on their behalf, but with time, we've been able to successfully sub-grant them to handle specific areas in the grant, and they've been able to demonstrate capacity to manage the funds in a manner that is consistent with the requirements of PEPFAR.
We actually wire the funds to their account, and they manage the funds and report back to us. So over the years, we've been able to transfer over 70 million Kenya shillings to Kenya Prison Service, and they've been able to manage that directory.
There has been a lot of capacity building even for the regional team in management of donor funds, including developing work plans, budgets, coming up with the budgets for the same work plans, implementation of activities under the same budgets, and accounting for the spending, for the expenditure incurred under the budgets.
We've also seen them take up a lot of ownership of the program, be able to plan, and for the last 2 to 3 years, the budgets and work plans that we submit to the donor have really been done together with them. We've also been able to offer them a sub-award or a sub-grant, which they have been able to fully take up ownership and plan on how they are going to use those resources, which has been executed quite well.
Capacity building. HealthStrat ensured KPS has the human resources to ensure sustainability of the program by leveraging the twinning model to recruit additional health workers, as well as advocating for uniformed healthcare workers.
When HealthStrat came in, we were understaffed. And during the period, HealthStrat have been able to facilitate this training and got a bit of our counsellors accredited.
We are thankful to health staff. They have posted 2 human resource personnel to our facility. That is the HRO and Health Records Officer, Mr. Gilbert, and a lab technologist, that is Alexis Mweni. They've really supported us in terms of offering services in management of tuberculosis.
We've gained a lot from them, and they've taught us to walk. Now we are able to walk on our own.
Over 100 staff were hired to support the project, and that has been a key milestone since that's an aspect of sustainability for the project. They really don't have to depend wholly on the counties because now they have their own uniform staff.
Improved infrastructure. Through the setting up of 2 isolation wards for MDR patients in Shimo La Tewa, Mombasa, and Kodiaga Prison in Kisumu.
One of the issues that we've been struggling with in the prisons is TB and also the MDR TB. So through the support, we have 2 clinics that to be able to deal with the MDR TB within the prisons. One is in Kodiaga and the other one is in Shimo La Tewa.
And this is the isolation that from their support from the PEPFAR and HealthStrat, they put up at least to have inmates to be isolated for TB cases. It's an isolation ward for managing the MDR cases, which has successfully managed for 3 successful clients.
If an inmate is identified with an MDR through ACF, active case finding, they are isolated. Since we had the isolation facility, that is, it was opened 3 years ago, we have found it so easy in terms of management of DRTB cases because the patient they accept, they have a conducible environment.
Commodity security. HealthStrat worked with the county governments to secure drugs and make them available to the different health facilities in the prisons.
Commodity security, we have worked with the counties, in all the 47 counties, working closely with them to be able to have the required supplies.
Initially, there were very limited. There was a very limited relationship between the county and the prisons because they would always say, health is devolved, but you guys are not devolved. KPS is not devolved. So they were expecting that they'll get all their support from the national government. But according to now, the discussion that we have had with the counties and the prison officers, we have been able to improve that relationship in such a way that they are able to leverage on resources that are at the county level, especially for supplies. And for me, as a supply chain advisor, I was able to work with the counties to make sure that they are able to supply medicines bought by the counties to the prison facility.
The antiretrovirals that we provided, the TB drugs that we provided to TB patients were actually resourced from the county, including even some of the lab consumables that we used were resourced from the county.
So on commodity, logistic on commodity transportation, like now if you get data tools that are needed in facilities, they're able to help us with transport, and we're able to make sure those commodities reaches the facilities where they're intended to.
And we have also the commodities within us. We've been enabled, from 2014, we did not have this facility, the TB clinic, but from the time the partner came, we've put some strategies whereby we are able to diagnose, treat cases here. Also, we receive from the county support supervision.
So this, we have the staff within the prison who are, we have actually been sensitized. We have the medical orderlies who have been also sensitized and OJT'd to man the dot registers.
And across of our facilities, we've been able to get that kind of support, to get the supplies, to get the lab reagents. You know, we have jointly held meetings with them while we do the technical assistance visits, and we go to them just to know, for them to understand what kind of support that we require.
The second aim was on HIV prevention. Under this aim, the Tact Project focused on provision of evidence-based combination HIV prevention services to KPS staff, their families and inmates. The key achievements under this aim included easy accessibility of testing and counseling services. 90% of inmates receive HIV testing and counseling within 2 weeks of prison entry. Increased number of clients identified as HIV positive. The third aim was on HIV care and treatment. The Tact Project endeavored to provide comprehensive HIV care and treatment services to HIV-infected KPS staff, their families, inmates, and surrounding community members. The key achievements under this aim included increased number of KPS health facilities offering comprehensive HIV care and treatment from 27 in 2014 to 45 in 2020. Increased number of clients put on ART. Overall viral suppression achieved at 92%. Improved PMTCT services. High number of pregnant and breastfeeding women put on ART. 96% of HIV-positive identified infants put on ART.
Mentor mother ni kupea wale wamama wanakuja clinic wakiwa wajawazito wenye hawajui hali yao, waweze kujikubali, waweze kujua ya kwamba kuwa HIV positive si mwisho wa maisha. So mi huwa mentor na naanza katika safari yao ya mimba kwanza day 1 hadi mpaka watajifungua.
The fourth aim was on TB prevention and treatment. The purpose of this aim was to provide TB prevention and treatment services to KPS staff, their families, inmates, and surrounding community members.
From the year 2014, when we started the clinic, or when we started managing our cases through the support of the partner, we've had a very drastic decline of TB cases.
The key achievements under this aim include the PF10 form was improved and used to screen 89% of new inmates for TB. Increased number of TB cases treated. Improved IPT uptake at 89% and IPT completion rates at 93%.
We have trained some cough monitors within the prisons who are also inmates. So these ones help us identify people who are coughing in the dorms where they usually sleep.
I do walk to every block that is within the facility to identify the coughers. And apart from identifying the coughers, I also link them to the facility, to the health workers, so that they can be taken to maybe a further evaluation.
The other thing, they've trained the documentation officers who have been able to properly utilize the PF10 form, which is an MOH form which screens every inmate coming to the prisons for TB.
PF10 has been very useful at the documentation section. Okay, first of all, it helps in identifying, early identification of the TB. and which leads to early treatment. And also we find out that it has the prevention of maybe the spread of TB to maybe even staff or even other inmates. And also we have inmates who come in with maybe they've been going through treatment when outside the prison. So they've come in maybe with their appointment card or drugs, or maybe they just have a contact to show that they've been undergoing treatment. So that helps us for them to continue with the treatment.
I'm a TB champion. What that means is I'm a victim of TB. It has been a game changer because since I had that, I had medication, symptoms, medication, and after the treatment, it has made me to be a role model because I came to understand that even if you have TB, that is not a death sentence. It's just a disease like other ones. And also in the office, in terms of motivation, it has motivated me to do more in terms of listening, more so listening to the new inmates who have come or who have been brought from court or other prisons within the Republic of Kenya and how to serve them.
The fifth and final aim was on monitoring and evaluation. The purpose of this aim was to monitor and evaluate program performance, addressing system sustainability, monitoring and evaluation of project activities, and effective dissemination of data collected to the relevant bodies. Key achievements under this objective are KPS staff successfully submitting reports by themselves to the sub-county for uploading onto KHIS on a monthly basis.
In terms of data management, the HRO, that is Mr. Gilbert, has really supported us in streamlining the data that we always transmit to the county, Department of Health, and to the national government.
Improved quality of data due to understanding of HIV/TB indicators. This was achieved through mentorship and capacity building of the sub-awardee, both at national and facility levels.
Capacity building was a key pillar of this project. Each of the staff across the different program areas had a counterpart within Health Strat who they are working with jointly in terms of implementation of the scope, and also in terms of reporting. They would also do joint visits together. There are those sessions you sit with them. If there are trainings, you're also able to train together with them. They also learn. If it is reporting, you're also able to sit with them and they are able to report.
So because of closely working with the Kenya Prisons management, the middle level Kenya Prisons staff, and even the frontline healthcare workers, there really has been growth in terms of capacity of the staff to offer quality HIV and TB services to the beneficiaries, who are the inmates, the Kenya Prison staff, their families, and the surrounding community.
One of the most important things that CDC will live to remember is the fact that we were able to train the healthcare workers in capacity building, training them to the extent that they're able to manage their programs. And I think some of the major deliverables that we always remember is the fact that our Kenya Prison healthcare workers were able to go out, support the programs. They were able to run their programs, plan, implement. And I think very remarkable is the fact that we were even able to write scientific articles that were presented in conferences.
Mine is to appreciate really the support that the CDC has provided for this constituency.
We are not as we were at the beginning, before Health Strat came. So I must appreciate for the far you have brought us and where you have left us.
So I want to appreciate because initially we used to have a lot of deaths. Mortalities was very high, and right now we have been able to take care of all that. The infrastructure that is there, initially we didn't have all those kind of infrastructure. Those health facilities have been improved, and now at least we can say we have gone very far.
They have really built the capacity of officers in terms of how we can manage TB and HIV in prison. We have had a number of officers trained by Health Strat, and also the collaboration between Health Strat and also the community outside has brought bridge between the prison service and also the community. As of now, I can proudly say we have the capacity to at least run the program.
We want to take this opportunity on behalf of the Kenya Prison Service and the Commissioner General of Prisons to thank PEPFAR for the support that they've given us, CDC and the health strat. I've already mentioned that through their trainings, our level of accountability has also gone up. And I know that this wouldn't have happened without that support.